Here's the audience. And myself.
Can you turn your phone on silent, maybe?
Yes.
What would you do to avoid having to wear a denture for the rest of your life? Preventive dentistry is something many Americans take for granted. According to the Bureau of Labor Statistics, there were 153,300 dentists in the United States working in the year of 2016. Yet many Americans suffer from gross decay, periodontal disease, or are edentulous wearing a complete denture. Having a healthy mouth should not be counted as a luxury, instead a necessity. If patients took the time to prioritize preventive dentistry, it would not cost a fortune when it comes to restorative work. Preventive dentistry is more cost-effective than needing to treat any problem that could arise in the mouth and is necessary to prevent dental disease. By the end of my speech, I hope to have stressed the importance of preventive dentistry and would have persuaded you to visit your dentist regularly. Preventive dentistry is, in a nutshell, is anything within dentistry that could and would prevent dental disease. If you have dental insurance, this is typically covered at 100%. If you don't have dental insurance, there are several ways that you could have treatment done. For example, Aspen Dental offers free new patient exams for patients without insurance, and that includes exams by the doctor and hygienist and a full set of x-rays. There are also colleges with dental clinics attached to them that will offer services at a reduced price. For example, at Florence Darlington Technical College, our dental hygiene clinic offers prophylaxis cleanings for $10 to students and faculty. When you compare the price of preventive dental procedures to that of restorative procedures, there is a huge difference. Some examples of preventive dentistry are as follows. Preventive dentistry would be an exam that would cost $50 or up, x-rays that would start at $65 and go up, cleanings that would start at $75 and go up, or fluoride varnishes that would start at $40 and go up. On the other hand, restorative dentistry would be a filling. A simple one-surface filling could start at $135 and go up, a simple extraction $150, a root canal $1,200, a crown $1,200, or if you need scaling and root planing if you have periodontal disease, that can start at $2,000. You can see how cost-effective preventive dentistry truly is. Even with going to the dental office twice a year for your routine cleaning, exam, and fluoride, the cost is much less than the majority of the restorative services. The ADA states, quote, to maintain optimal oral health, the American Dental Association recommends regular dental visits at intervals determined by the dentist. The dentist that I have worked for in the past and currently work for recommends that you have one set of x-rays, 2 cleanings, 2 exams, and 2 fluoride varnishes per year. With insurance, this would be free to a patient. With a patient without insurance, this could be less than $200 for an entire year of preventive dentistry. There are circumstances where people cannot afford an extra $200 a year. However, preventive dentistry starts at home. General recommendations from the American Dental Association are as follows. 1, brush your teeth twice a day with a fluoride toothpaste. 2, clean between your teeth, or in other words, floss. 3, eat a healthy diet that limits sugary beverages and snacks. 4, see your dentist regularly. There's no secret that preventive dentistry prevents dental disease. For this, I will be using the example of sealants. Quote, the dental profession has long regarded dental sealants as primary element in the prevention of dental caries. A dental caries is a cavity. End quote. Jan Sylvia, a peer-reviewed publisher. She goes on to say, quote, the occlusal surface of the teeth contains deep pits and small fissures that make these areas difficult to clean. The occlusal surface accounts for up to 90% of all caries found in school-aged children. The teeth at the highest risk for caries are the permanent first and second molars. Dental sealants are a means to prevent by painting a resin coatings onto the pits and fissures of the occlusal tooth surfaces. Dental sealants have reduced caries over 70%, and sealants work by means of simply providing a physical barrier between the susceptible pits and fissures of the tooth and the cariogenic bacteria. If the cariogenic bacteria cannot get into the tooth, bacteria cannot cause decay. End quote. Preventive dentistry needs to be a priority to people. We shouldn't neglect our teeth until they've started hurting. Once pain is present, that's a good sign that you'll need a costly restorative treatment. For instance, once you have a toothache that's unbearable, you're typically going to need a root canal and a crown to save the tooth, which can cost $2,400, or extract the tooth. Instead, be smart up front. Use the knowledge gained from this speech to make better decisions regarding your oral health. Remember that preventative dentistry is more cost effective than having restorative work done, and it is necessary to prevent dental disease. You only have one smile, so take care of it.